Hello and welcome to this session on evaluating national and local policies. In this session, we're going to explore what is evaluation and why we should do it, how to evaluate policies related to public health using 3 key frameworks, and remember, policies have programs and projects inside them, so often when we are evaluating policies, we are actually evaluating programs and projects that are inside policies. We will then look at creating and using logic models to understand how a policy affects community and population health and well-being during the design stage of a policy or program or project, as well as afterwards when we are looking at the effects of a policy without actually doing any research. And in the apply session, we're going to use the ideas and concepts from this video lecture to look at how to think about evaluating a policy and also your chosen policy. So what is evaluation? Before we can move and discuss evaluation, we need to think about what is an intervention. An intervention refers to national and local policies, projects, programs, initiatives, and other activities. So all of these different things can be evaluated, and the approach we use to evaluate them are the same. There are no evaluation frameworks that can't be used for national and local policies, for projects, for programs. All the evaluation frameworks we're going to talk about in this session can all be applied to policies, projects, programs, services, initiatives, and any kind of activity. So what is evaluation? It is a systematic way to improve and account for public health actions. We want to improve people's health, and we want to be accountable in terms of the money spent, the staff used, the time that we have needed in order to implement the policy, in order to action the policy, and the programs and projects within that policy. And we need to check whether the money we've spent, the time we've spent, and the people we've had implementing that policy and operating that policy has been of some value. We have actually improved people's health. And the only way we can do that is by doing an evaluation. And the evaluation should be useful, feasible, ethical, and accurate. Useful in that the evaluation should provide useful, valuable information that we can use to improve our policy and the programs and projects within that policy. It should be feasible in that we can actually do the evaluation. It shouldn't be so expensive, so time consuming, needing so many people that we can't actually do the evaluation, or it's not doable on a regular basis. It needs to be ethical in that it ethically looks after the people who have been affected by the policy, as well as the staff who are implementing that policy and the organizations that are involved in delivering that policy. So it needs to make sure that it looks at confidentiality, anonymity, that it looks at the welfare of the people involved during the evaluation and the people who are being researched. And it needs to be accurate, because if it's not accurate, then it's not going to be a very useful piece of evaluation. So an evaluation, in a more detailed definition, is an assessment that is systematic and impartial of an activity, project, program, strategy, policy, topic, theme, sector, or operational area. It focuses on both what we hope to achieve the expected accomplishments as well as the actual achieved accomplishments of the policy, program or project. It looks at the chain of causation. It looks at the processes involved in delivering and implementing that policy. It looks at the wider contextual factors in order to understand why we achieved what we did and why we did not achieve what we had hoped we would achieve. It should be relevant, it should be impactful, it should be effective, it should be efficient, and it should be sustainable. That is what we hope the policy and the programs and the projects within them are. That's what we hope to demonstrate, that the policy we have is relevant, it is useful for people, it is benefiting their health and well-being, it is having an impact, it is creating a difference in people's lives, it is effective in terms of what we hoped it would deliver, it is efficient in terms of value for money, and it is sustainable as a policy that we can deliver it over the long term, over 5, 10, 15 years. The evaluation should use evidence and provide a credible, reliable and useful set of findings and recommendations from what we have collected from people and from documents we've read and from observing the process. And those lessons learned that we identify through the evaluation should feed into the decision making and management processes of the policy, the program and the project. And evaluation should not be something done at the end. It should be done and considered throughout the life cycle of the policy. So it should be thought about from the beginning when the policy is being designed, and evaluation should be embedded in how the policy is implemented and how the policy is delivered. So why evaluate? The reason we evaluate is we want to improve people's health and well-being, and we want to do that in a way that is value for money, that works well, that makes a difference, and that we can do for many, many years, is sustainable for 5, 10, 15, 20 years. And evaluations help us to do that. So let's look at a more detailed explanation of why we evaluate. Because we want to optimize the use of time and resources means money, staff, equipment, buildings, and so on. And this is about efficiency, about value for money. We want to determine if a policy and its programs and projects are meeting the needs of target population we hope to help, achieving the aim, the goal of the policy. We want to identify ways of improving a policy and its programs and projects if they're not working well, making it more effective. We want to demonstrate the effectiveness of a policy and its programs and projects, and that's more about getting or maintaining funding by showing others that it works, to other public health professionals, to politicians, to funders, to communities, and to other stakeholder groups. We can use evaluation to compare one policy and its programs and projects with others. We want to demonstrate effectiveness compared to other similar policies. And lastly, evaluation can be part of continuous improvement in the quality and effectiveness and the value of our policy and its programs and projects, to maintain the effectiveness of a policy over time as things change, contextual factors, as people change, as diets change, as physical activity levels change, as social and cultural factors change. Our policy can adapt and be flexible enough to continue to meet the needs of the people we hope to help. What do we evaluate in a policy? Well, policies, programs and projects are all interventions. They're actions we take to improve people's health and well-being. Policies are made up of many smaller interventions, and so usually we evaluate these smaller interventions, the many programs and projects that are inside a policy. And so we often evaluate these separately rather than the whole policy in one big go. However, some policies have only one intervention. For example, the ban on smoking in public spaces was one single intervention where there was a complete ban on places like pubs and restaurants allowing smoking. And just a refresh about what is a program, public health and health promotion interventions are often delivered through structured programs. A program is any group of related complementary activities, often related projects, intended to achieve specific outcomes or results. A program is a collection of projects on a similar topic, a similar theme, like sexual health or drug misuse or alcohol or smoking. For example, community gardens, shopping skill classes and healthy cooking demonstrations could be part of a nutrition program for low-income families. There are two broad types of evaluations around topics and around staffing. You can have thematic versus programmatic evaluations. So programmatic evaluations are simply that. They're around a program, a set of projects within a theme. A thematic one is wider. It looks at all the programs within a set policy area, for example, sexual health or smoking or alcohol. So we would look at a thematic area like smoking and look at all the programs that are running within that thematic area. We can also have internal versus peer versus joint versus external evaluations, and these relate to the staffing, who does the evaluation. So you can have internal staff to undertake the evaluation, the people who run the policy, who are implementing the policy, who are implementing the program, who are running the program or the project can undertake the evaluation. Now there is a potential for there to be bias because these people are being paid in the program and in the project, so therefore they may want to make the evaluation look good, that the project is working because their jobs depend on it. So what you will do is you will get peers. These can be internal or external to the organization to undertake the evaluation. So in this context, you are looking for people perhaps in public health who are in another council area who can then evaluate your programs and you in turn evaluate theirs, or another council's public health policies or programs or projects. Or you could have internal members. For example, in a council, maybe the social care department and the professionals in that department may go and evaluate the public health team's projects and programs and policies. And sometimes you can have joint ones where staff from two or more organizations come together and they do joint evaluations on each other's policies, programs and projects. And lastly, you can hire external evaluation consultants and experts, academic experts, for example, to undertake the evaluation as a third party independently of any staff involved in the policy, program or project. What kinds of things do we look at when we evaluate a policy and its programs and projects? We can look at process aspects, also called formative aspects, and this looks at how the policy and its programs and projects have been implemented or are being implemented, how they've been run or are being run, how the programs and projects are delivered, and the procedures and ways of working within the programs and projects. We can look at what is working well and what is not, how efficiently the policy is working, what are the barriers to organizations and their staff, and this could include organisations such as Public Health England, it could be organisations like local councils, it could be organisations like charities and voluntary sector organisations, or it could be businesses, and how that is impacting on their staff in terms of working efficiently and effectively to deliver that policy and the programmes and projects within that policy. This can be done at any stage, but is particularly useful in the design, pilot and early implementation stages so that we can improve the policy and its programme and projects to maximise the benefits from the policy. We can then also look at the outcome aspects or the summative aspects, and this is about short-term impacts and long-term impacts. What are the short-term benefits and the long-term benefits of the policy and its programs and projects in terms of improving the health and well-being of communities and populations? We often do this at the midpoint of a policy cycle in its operation, or at the midpoint of a program or a project, or near the end of a policy or a program or a project. And lastly, we can do real-time evaluations, and these are special evaluations often used for humanitarian assistance programs in disaster relief, where we want to have immediate and real-time feedback from communities, from stakeholders, from staff, to ensure that the humanitarian program is running and operating efficiently and effectively. What are the methods used in evaluations? They're the same as the ones used for any kind of research. We can use qualitative methods, which are interviews, focus groups or group interviews, observations where we can watch how the program or project is running, how the policy was implemented or is being implemented, and we can analyze public and organizational documents, including media reports, to look at how the policy and its program and projects have affected people positively and or negatively. We can also use quantitative research methods, such as collecting quantitative data while the policy, program or project is running. For example, how many people use the programs and projects delivered through a policy? Were these people the intended target group of the policy? What were those people's health status before and after the policy was implemented? How much money was spent per person? How many staff and other resources were used per person? And how big a geographical area of people did the policy help? And we can do that through, for example, a questionnaire survey. Or we can use existing statistics and data collected through the programs and projects to work out this information. So remember, policy evaluation is part of the general and the public health policy process, which starts with problem identification or issue recognition or agenda setting, then leads to policy formulation and adoption, then policy implementation, and finally policy evaluation. But remember, policy evaluation needs to be thought about across the whole cycle, not just at the end. And just a reminder, the public health policy process is slightly different, because when we are delivering or developing a policy as public health professionals, we start with analysing and assessing population health needs. We move on to assessing possible intervention options. We develop detailed policy choices. We then choose one of them, we implement it, and then we evaluate it. And again, we need to think about evaluation across the whole policy cycle, not just at the end. So it's worth thinking about, when you read a policy, do they talk about evaluation in that policy and how they are going to evaluate the policy? Well done policies will talk about how they are going to evaluate that policy. Let's move on to how we can do evaluation. Now, this is a very big topic, and therefore we can only touch and provide a very brief introduction to this area. Evaluations look at the implementation, the process and the outcome of policy, how the policy was implemented, how the policy was designed and how the policy was delivered and run, and then lastly how the policy delivered positive health outcomes. We want to measure, as public health people, whether the policy has improved health and well-being, and that is a really important criteria for us. We're not interested in other aspects. So we can do this directly by collecting information about the intended and unintended health and well-being effects of a policy and its programs and projects, and this would be directly from the programs and projects and the people affected by the policy by doing some research using qualitative methods and quantitative methods. But we can also do it indirectly by using existing research evidence and developing a logic diagram, and indirectly making a judgment about the effectiveness and the value of a policy and how it might have influenced and improved and affected people's health and well-being. There are many models and frameworks for doing direct evaluations, and we are going to briefly look at 3 of them. The US Centers for Disease Control and Prevention's evaluation framework, the WHO World Health Organization evaluation framework, and the LEAP framework, Learning, Evaluation and Planning in Community Learning and Development, developed by the Scottish Government. The US Centers for Disease Control and Evaluation framework has a number of parts, 6 parts. We start with engaging stakeholders right at the top. We then move clockwise to describing the program in detail, understanding how it works, understanding what it is intending to do. Then we develop and design the evaluation based on the description of the program and its aims and objectives. And then we collect evidence through qualitative and quantitative methods, and then we interpret that evidence and information. We can also bring in scientific research evidence from other countries and other programs and projects and policies, and then we develop a set of conclusions and recommendations, and those recommendations and those conclusions should then be shared with people both within the program and project, as well as outside into the wider community, to the general public and to other people internationally who might be looking at developing similar policies. And then we start the cycle again with engaging stakeholders and going around the whole evaluation process. Now, the Centre for Disease Control's model has 4 standards or 4 values: utility, feasibility, propriety and accuracy. And these values, utility is about being useful, serving the information needs of intended users. And if you remember that evaluation definition in an earlier slide, that also talked about being useful. Feasible is about being realistic, prudent, diplomatic and frugal, being value for money in terms of delivering an evaluation that is effective and useful, but does not spend a huge amount of money or time and other resources, that it is deliverable, that it is doable. Propriety is about ethics, and again, if you remember, that was one of the issues that the earlier definition of evaluation brought out: behaving legally, ethically, and looking after the welfare of the users, the people who are benefiting from the policy, the program, project, the staff who are involved in the policy, project, program, and everyone else who might be directly or indirectly involved. Accuracy is about being accurate in our findings and sharing those findings accurately as well. So we need to be accurate and use the right methods to generate the evidence and information about what was working and what was not working about a policy, a program or a project. And we need to also share that information accurately to others so that they can learn from our evaluation. Now let's move on to the World Health Organization evaluation framework. And you can immediately see this is very different from the US Center for Disease Control's model, and it starts with planning, then it moves to conducting the evaluation, then it moves to reporting, and then it moves to using and following up on the results. Now, it looks like this model is very different, but it is not. There are a lot of similarities between the two. So in the first one, the CDC one, they talked about engaging the stakeholders, talked about looking and describing the program, and then developing the evaluation design. And it's a similar thing here. In planning, these are the things that are covered in the WHO evaluation framework, where we develop the evaluation questions and criteria, the terms of reference, what are we going to do in the evaluation, what we aren't going to do. We're going to choose the methods we need to use. We're going to look at the resources, the staff, time, money we need. We're going to look at the structure of the management, manage any conflicts of interest, develop a work plan. And in this case, you develop a starting report, and then you move on to doing the actual evaluation, collecting that information, which again was a part of the US Center for Disease framework. And then we move on to reporting, which is about drafting the report, which is about sharing the information in the CDC framework, and then finally communicating the findings from the evaluation. So there are similarities, there are differences, but there are also similarities between the two frameworks. It is following a broadly similar approach. And the WHO evaluation framework also has a set of values. Utility, same. Evaluation findings are relevant and useful, presented in a clear and concise way, and monitored for implementation in the future so that we improve the policy, improve the program, improve the project. And utility or the usefulness depends on producing timely findings so we can actually do something with them. They need to be relevant to the policy and program, relevant to the stakeholders, and they need to be credible in terms of how it was done. And it needs to be also clearly communicated, accessible. We need to write it in a simple, clear way so everyone can understand what we've put and what we've found. Quality, we need to, again, similar issues. If you remember the CDC framework, we need to have and use accurate criteria. We need to do an accurate analysis, and we need to have coherent findings and conclusion recommendations that make sense in relation to what we've done. So the quality of the information needs to be high. And lastly, similar to the ethics bit in the CDC values framework, stakeholders are aware of the purpose and objectives of the evaluation, the methods, the process, the criteria, and that they have access to the evaluation materials and products. So the evaluation is open. It's not a hidden evaluation. It's not being done behind their backs. It is open. Transparency here is about ethics, which again links back to the CDC framework. Lastly, let's move on to LEAP, which is a Scottish Government evaluation framework. And this, again, is slightly different. It's almost similar to the policy cycle, but not quite. And so we start off on the left-hand side with what is the need of the population in relation to the policy that we're interested in. And so step one for the evaluation is saying, what difference do we want to make? What was the policy about? And what will we need to do now in terms of if the policy isn't working, or if the policy is working, how will that inform? What will we need to do now? Why are we doing the evaluation? What are we hoping to get out of it? Then step two is about how will we know we have made a difference in the policy? What kind of indicators can we use? How can we measure the change in health and well-being that we are hoping for from our policy and its programs and projects? And step three is, what do we need? What resources will we need? The inputs and the outputs are how will we use the resources and methods in our evaluation? And thirdly, what processes will we use? And so step three is about the doing of the evaluation. Steps 1 and 2 are more about the design of the evaluation. And then lastly, we have monitoring and evaluation as two separate parts. Monitoring is an ongoing thing. It happens yearly or 6 monthly or 3 monthly. Evaluations happen at the midpoint or at the end of a policy or project or program. So here again, you can see some similar themes coming out. If you look at the last step 5 evaluation, did we make a difference? What have we learned? And while this one does not say anything about sharing that information, it is implicit in there that what we have learned is being shared, so that we can then go back to step 1, see, and again follow the cycle to improve the policy, the program, and the project. Again, LEAP has some values, and LEAP has some very broad values around empowerment, participation, inclusion, self-determination, and partnership. And these are based on the following principles that emerge from those values around empowerment, participation, inclusion, self-determination, and partnership. So it's a needs-led approach, and this is about empowerment and participation. It responds to the experiences, ambitions, and concerns of communities, and targets issues of inequality and social justice, which links into the point about inclusion. It builds capacity. So again, it's about empowerment, develops the assets, knowledge, skills, and time of individuals, groups, and communities. And this also links into self-determination and partnership working. It's change or outcome focused. It aims to achieve real and measurable change in the quality of personal and community life, and in the health and well-being of individuals and communities. And again, this is about empowerment, and it is about inclusion. It is participatory. It involves everyone who is involved in the change or desires change. It builds partnerships. And it's a process of learning and continuous improvement, so that we are constantly aiming to improve the policy, the program, or the project. So what do we want to achieve through evaluations? We want to achieve a number of different things. We want to know what things are actually being delivered and to whom they are being delivered. What are we actually doing on the ground, and who are we actually supporting on the ground through our policy, program, or project? What are the intended outputs, impacts, and outcomes? What we hoped for, and what are the unintended outputs, impacts, and outcomes? What we did not intend or plan for to happen. Are we contributing to health and well-being? Really important. Are we making the best possible use of the resources, the time, the people, the money, the equipment, the buildings, and so on? Do we have the evidence we need to influence future decisions? So is the evaluation providing enough good quality evidence, robust, credible, useful, to influence future decisions around the policy, the program, or the project? Are we gaining a new understanding of community needs and issues through our evaluation, and recognizing that where we aren't meeting their needs, the policy is not meeting their needs, the program is not meeting their needs, the project is not meeting their needs, and then how we might help to change the policy, the program, and the project to better meet those needs? Are we being effective in tackling the community needs that we hoped we would tackle? Are we being inclusive? Is health equity and health inequalities being covered? Is health equity being improved, enhanced, and are health inequalities being narrowed? Are the participants achieving their personal goals and visions? Are we building community assets and resources? Are we focused on more than just community needs, gaps, and deficits? Is our work empowering people who we hope will benefit from our policy, from our program, from our project? Are we building a culture of collaboration, participation, and sustainable change? Are we working together with communities and professional stakeholders and anyone else who is interested to really improve and embed the policy, the program, the project that we are trying to deliver, that we hope will change people's health and well-being? And are we learning from our experience? Are we using the evaluation and our monitoring throughout the project, using that to improve the policy, the program, the project? We're learning from our experiences and making things better. What do we look at in terms of the process aspects of a policy and its programs and projects during an evaluation? we can look at a number of things. We can track the number and types of people who are reached by the policy and its programs and projects. We can track the number and types of activities provided through a policy and its programs and projects. We can describe how the activities are provided. We can describe what actually occurs while providing the activities. Is it what we intended, or is it something different? We can look at the quality of the activities provided. We can look at how well was the policy and its program and project implemented. In terms of the outcome of a policy and its programs and projects, what can evaluations look at? They can look at changes in attitudes, knowledge and behaviours, look at changes in diseases and death rates, morbidity and mortality. It can look at the number of people who participated or were served by the policy and its programs and projects. It can look at the benefits that people received from the policy and its programs and projects and the cost of that benefit that they received. It can look at the cost effectiveness of the policy and its programs and projects in terms of how each program was effective and how much it cost to deliver that program or project within the policy. It can look at whether the policy and its programs and projects have led to changes in other policies, intended or unintended. And it can look at changes in ways of working across regional and local organisations and systems that are tasked with delivering the policy and its programs and projects. And lastly, we can look at the wider impacts and benefits, potentially unintended benefits that might emerge through that policy and its programs and projects. And of course, we can also look at the unintended negative impacts and the harms that might come from a policy and its programs and projects. So remember, the wider benefits we're talking about is these determinants of health. So where a policy may focus on, for example, improving access to banking, it may also improve things like housing, tenure, personal transport, access to other services through that policy around improving access to banking and financial services. So we need to look at potential wider benefits that might come out from a policy and program and the projects within that policy that are not just the direct aims and objectives of a policy. Now let's move on to using logic models in evaluation. Logic models are really helpful, and we will look at 3 examples. The first example is looking at changing school environments. This is a logic diagram for childhood obesity program where school food and beverage environments are improved. And so we start with inputs: human resources from the Ministry of Health, health authority staff, human resources from the Ministry of Education, school district staff, partnerships with community organisations, partnerships with the private sector vendors of the food in schools, and technology that might be needed, as well as other additional funding. And the activities involved in this project, this program of improving school food and beverage environments, is updating the nutrient criteria used in schools, updating and creating implementation tools, launching updated guidelines and resources for school, assessing the food and drink items in schools currently, collaborating with food vendors to improve the quality of and the healthiness of food and drinks that they currently provide, and improving the selling of food and beverage items that meet the guidelines. And the outputs could be significant changes made to the guidelines, reflecting the current evidence and experiences in schools, improving and redevelop the existing tools so they're more fit for purpose, and looking at increasing awareness of the gaps in school food and beverage environment in both teachers as well as food vendors, as well as other stakeholders, including parents and school children as well. And then we can move on to the potential outcomes, both the immediate outcomes, the intermediate outcomes, and the ultimate outcomes. As I said, often immediate outcomes are called impacts, and the intermediate and ultimate outcomes here are called outcomes or long-term outcomes. So we can improve the behavior and the ways that school districts provide food and the types of food they provide, and that could lead to a change in what kinds of foods students consume, which then leads to an improvement in cognitive and psychosocial capacity in students and school pupils, and which leads to ultimately decrease in morbidity and mortality. Please pause this at this point and go through this in more detail to understand the value of these kinds of logic models. And let's look at a slightly different model. This is a little bit simpler. It's the ban on point of sale of tobacco displays. So we currently have a ban on showing tobacco products. They are usually behind a kiosk with a closed door. So what was the logic model for this intervention, this policy intervention? Target is all age groups. It affects everyone from children to adults. They won't be looking at it. So the implementation is about compliance, making sure supermarkets and local stores are complying and putting tobacco behind a closed door kiosk. It's also about changing the knowledge about the policy. It's having penalties, and it's communicating the new policy around point of sale tobacco displays. And the immediate outcomes, the proximal outcomes, are changes in attitudes and beliefs towards smoking, hopefully by people not seeing the tobacco product. They will be less interested in buying tobacco products, and so hopefully we will change immediate behavior. And there's a potential that there will be increased stigma associated with purchase, so people will feel more embarrassed about it, at least initially. And the perception of smoking being widespread, it's being openly displayed, is changed to that of, oh, actually there must not be a lot of smokers, because I can't see any cigarette packs and shelves full of cigarettes in supermarkets. And hopefully that will lead to a change in behavior, that less people take it up because they're not susceptible to it, they don't see it, and they don't think about it, and hopefully increase the number of people who try to quit, because every time they go, they see it behind a closed door, and they know that the reason it's behind a closed door is because it's not good for people, and the government is trying to stop people taking up smoking. And then, of course, the long-term outcomes, the distal outcomes, are around reducing lung cancers, reducing respiratory illness, reducing death rates, and reducing use of health services, increasing the health and productivity of people so they work for longer, and other types of social change that is both positive, a normalization of smoking, so less people feel that it's normal to smoke, and more stigma around smoking, which in itself does have negative impacts. Increasing the stigma on people who smoke does have negative impacts on the mental health and well-being of smokers, so we do need to think about that. Again, please have a look at this in more detail and think about going to the actual journal article that has this logic model to understand it better. And lastly, again, a different type of model for promoting physical activity and eating well. Again, this one has program activities on the left hand side, then impacts and outcomes. So the program activities are establishing a program of governance and administration around the program, identifying effective and efficient interventions as part of this program, developing an action plan, an implementation plan, and then creating supportive environment, for example, having laws and policy change. So this is one where they are thinking about what kinds of change we could have. So one aspect could be laws and policy change. Another aspect could be community action for change, getting communities involved. Another aspect could be health education. Another aspect of the program activities we could have is around social marketing and so on. And then we can look at impacts, which is increased health literacy, knowledge and attitudes around healthy eating and being active, strengthening partnerships and community activities around being active and eating well, changing policy and creating more healthy public policy, creating better environments where people can get easier access to healthy foods and also able to do physical activity in a safe and enjoyable way. And lastly, all of these things should hopefully reduce inequalities, reduce the prevalence of overweight and obesity, improve quality of life, and reduce disease and death rates from chronic disease. And again, please have a look at this in more detail to understand how you might develop your own logic models for your chosen policy. So what is the value of logic models? Well, I hope you already get a sense of what the value is from the 3 examples we've looked at. Logic models are a systematic and visual representation of a policy, program or project. It shows the community and organizational resources that are available or needed, the inputs. It shows the planned activities, the process or immediate outputs, and it also looks at and identifies visually and systematically the outcomes and impacts of a policy, program or project. It's a roadmap for how these things, the inputs, outputs and outcomes, are linked together in a logical way, and it can be used to plan and evaluate activities around policies, programs and projects, and what they are currently doing and what we hope they should be doing. By setting out the anticipated theory of action at the design stage, for example, or during the evaluation, we can develop this theory of action in terms of how we hope the project, the policy, the program is going to produce positive benefits around health and well-being. We can look at the inputs, outcomes and outputs, and it helps us to develop ways to measure and track the inputs and outputs and the outcomes of our policy and its program and projects. Please have a look at the materials on Blackboard. There is some very interesting stuff there, and this will help you to think about evaluation of your chosen policy, as well as get a better understanding of the importance and value of evaluation. Well, I hope this was a useful session for you. I hope you enjoyed it. I look forward to seeing you in the apply session. Goodbye.